Hi everyone, I hope you're all well. We're still really worried about this thing over my shoulder, coronavirus, and over the last few days my colleagues and I have been working frantically to try and identify ways by which we can continue to treat patients with cardiovascular disease. The important thing is to try and identify those patients who really need treatment, and then to try and find a way to ensure A, they're not carrying coronavirus or already inflicted in a subclinical way with the disease, and also to make sure that they don't get the disease in the perioperative period. Now, the sorts of patients we're really worried about are patients with aortic valve stenosis. These patients, when they are symptomatic, have a long-term outlook worse than any cancer in the Western world. They clearly need to be treated. The other group of patients that we're worried about are patients with left main stem coronary artery disease. These groups of patients are really important to us. Now, it is likely that many of these patients will end up presenting in hospital and then requiring urgent treatment. But we also need to be cognizant of the fact that whilst they're on the waiting list, we need to try and identify them and find routes by which we can treat them before they decompensate. In order to do that, we've got to find a way to first identify whether they are carriers of the coronavirus and whether or not they've developed early subclinical lung disease. And the way we've decided that we're going to do that is to perform coronavirus screening using PCR. But as you know from our previous videos, up to 30% of these tests will be falsely negative. In other words, you might still have it in about a third of people. So we're going to augment that with chest x-ray and CT scanning of the lungs. This will give us a better idea of whether or not patients have developed early lung changes from coronavirus disease. Now, the way that we try and prevent patients from getting coronavirus in this environment is the more difficult one. It's going to be really hard to do that when our intensive care units are A, filled with patients with the disease, and B, it may well be that we don't have the ITU beds to treat these patients anyway, but we have to find a way. What we've established is a process whereby we can ring fence some cardiovascular space and try and minimize that space in terms of its exposure to coronavirus patients and coronavirus itself. This is going to be a very difficult undertaking, and we're continuing to work hard to make sure that we're able to identify patients with cardiovascular disorders that need to be treated, to identify methods by which we can make sure they haven't developed subclinical disease, and also then to find an environment by which we can treat them without them contracting coronavirus perioperatively. We'll give you some more updates either later in the week or towards the early part of next week. But in the meantime, if you have a cardiovascular problem and you become unwell and you start to decompensate at home, then you must ring NHS 111 and let them know about your underlying problem, and they will give you some advice. If you develop coronavirus, and remember the symptoms, a persistent cough and or a high temperature and or breathing difficulties, then beware that what you need to do is socially isolate. And if you get worse, again, ring NHS 111, let them know your underlying condition. And if you get really bad, you will need to ring 999. If you develop problems, you must not be afraid to come to hospital to be treated, because if you aren't, you're going to get in a really big trouble. One of the things that we've learned from the Italian experience is patients with coronary artery disease were preferring to stay at home whilst having heart attacks than presenting to hospital, where they would have received treatment that could have been more beneficial to them, or perhaps could have even saved their life. So it's really important in this environment, if you become unwell and you've got a heart problem, that you contact us and let us know. Bye for now.